is Julie Schultz, and I am the Executive Director of OPS. The Oregon Pediatric Society is a nonprofit that promotes the best health and development of infants, children, adolescents, and young adults, together with their families, communities, and healthcare providers. I'd also like to introduce OPS board member Dr. Ken Carlson from Childhood Health Associates of Salem, who will be co-moderating our discussion today. Welcome, Ken.
Thanks.
So it looks like right now we've got about 52 participants on this call, which is terrific. We're looking forward to a robust conversation today. Since we won't have time to introduce ourselves individually, we'd like to get a sense of who is here. So Amber Ziering from our staff is going to pop up a poll that you should see. We're digging all this Zoom technology. So if you would check as many, if you're able to see that poll on your screen, if you're able to check as many boxes as you can, we'll report back on the results of who is here in a more aggregated way. During the Zoom meeting, we would like to see and hear from you. We've started everybody off on mute, so that we don't get a lot of technical interference. But please type in the chat box, which probably most of us are familiar how to do this now, but if you hover on the bottom of your screen, you've got a chat icon. You can click on that and then you can type any questions or comments that you have in that box. And then Ken and I will be kind of, and folks will be kind of monitoring that chat box, excuse me, and we'll call on people when it's time to talk or you have a comment or we'll reference to what you've said. We'll figure this out. We won't talk on top of each other. We are recording this so that others can hear your perspectives, and it will help the Oregon Pediatric Society develop our messaging for parents and for policymakers. And right now we've got, and I can see it. I'm assuming everybody can see the poll results. Very cool. Okay. So you can see that we've got folks in a lot of different categories. We've got administrators, we've got educators, we've got people who work at school-based health centers, school nurses, urban pediatricians, rural pediatricians, policymakers, and that infamous other. So thank you. Again, this collaborative discussion is really going to be terrific, representing different sectors. Okay, so COVID rates, infection rates are rising in children and teens. I think we're all aware of that. The pandemic has been called an X-ray by the UN Secretary General, quote, revealing fractures in the fragile skeleton of the societies we have built. A joint statement from the American Academy of Pediatrics, the American Federation of Teachers, the National Education Association, and the School Superintendents Association, and Amber, you can pop that slide, was released July 10th, 2020. It said, in part, returning to school is important for the healthy development and well-being of children, but we must pursue reopening in a way that is safe. Repeat, safe, that was always the guidance, for all students, teachers, and staff. Science should drive decision-making on safely reopening schools. Public health agencies must make recommendations based on evidence, not politics. We should leave it to health experts to tell us when the time is best to open up school buildings and listen to educators and administrators to shape how we do it. So, how do we do it? The solutions are not one size or one community fits all. And without in-person school attendance, how do we provide all kids in pre-K to 12th grades with equitable access to quality education, social connection, and social services? Ken, on that note, I'm gonna hand it off to you for anything that you have to say. Again, folks, I'm gonna encourage comments in the chat box. Wave your hand if you don't do the chat box, and if I can see you, we'll call on you that way. We're looking forward to again, a wonderful conversation today. Ken?
Yeah, thanks. We got a fantastic group today, a large group and a very diverse group. You know, people with different settings, and it was interesting. The other was the largest category. So love to hear where people are coming from and things around that. Speaking from my own experience as a practicing pediatrician, you know, I've been asking over the last several months, you know, with every well child, you know, how did things go for you in school? How did your family kind of navigate that? What was the impact? Did it work for you? Did it not work for you? And heard there were a lot of kids that it didn't work for them, and some it did, you know, and hearing the challenges that came with that. So I think what I'm hoping to hear, you know, we have a few goals around this. I don't think we're going to solve this and have all the answers in 1 hour, but I think since we have people from different areas of the state, you know, hearing what plans, if any, they know about are happening in their community with their school systems or any decisions that have already been made. What are you telling patients if you're in a provider role? What kind of questions are you getting? How are you counseling that? You know, as I've kind of thought about this over the recent weeks and months, I've thought we've all had to kind of turn into our own public health epidemiology experts and kind of navigating families through a risk assessment, whether it's school or childcare or back to work, about, you know, how many cases are in your, you know, in the community, what are the medical factors that a patient may have or other family have, and all those considerations, trying to kind of walk through that with the family to advise them on, you know, what's there. And we have this added uncertainty of kind of where are rates going, and what are our school systems going to do. I do know in our own area in Salem that they're offering an option of online, just kind of as an option. So they're kind of looking towards more of a hybrid, to give some choice around that, because I think, you know, as we've seen in guidelines from the state and from AAP, the goal is, you know, if the goal is safety, that's smaller numbers, more spacing, more masking, and, you know, what does that look like? So I just, you know, and again, for those that aren't in direct medical practice, what are conversations you're having at that policy level, state level, or whatever your setting is in? And we have some school-based folks as well. I'd be fascinated to hear about what plans and discussions are happening there, because, you know, hopefully you guys are getting pulled into those conversations at those schools that you're set at to discuss how to do that and things. So lots and lots of issues. We'll see where this goes. I want to open up the floor and see what thoughts or questions people have.
And people can unmute themselves as well. They should have the ability to do that. If there's any issues with that, we can help you.
So good morning. I don't know if you can hear me. I'm Dr. Nancy Zink. I'm from OHSU and I work at the School-Based Health Center at Benson High School here in Portland. And so far the guidance I've heard from Portland Public Schools, which is very little, has been they are not going to require masks for any of the students. And I've been trying to push back on that to, again, say the CDC guidelines and the governor's guidelines, but I have not heard that they are going to require masks for students. So I'm just very concerned about that and want to see if anyone in this group has any input on that or knows anything more or has pull with the state. I just want the best for our students and our staff and everyone in the schools. So maybe someone knows more about this and can comment.
Dr. Zink, thank you. Thank you for that comment and starting off with a very important issue. I see Dr. Gilmer is wearing his mask. I've got my visual aid here as well. We had anticipated some guidance coming out yesterday that is now coming out today from the governor about masking in schools that will address your concern. I don't want to overshadow the governor's announcement. But I think it's a policy that will make many of us very happy about masking with children at school.
And Christina, I see that your hand is raised, so go ahead.
Yes, I'm Dr. Christina Lanciani. I'm a pediatric infectious disease physician. I work at Dornbecker Children's Hospital in Portland, Oregon. I am sitting on the governor's K-12 Healthy Reopenings of School Board. I don't think that's the exact title, but you get the gist. And our last meeting, which was last week, the new rendition of the guidelines is going to include universal masking for staff and students K to 12. There was quite a bit of discussion about recommendation versus requirement. And to be honest, I'm not sure where that's going to fall in terms of language and the requirements. But it was fairly clear during that discussion that the next rendition would include the masks for K to 12 for both students and staff. And I strongly, strongly support that recommendation.
Dr. Lanciani, thank you so much for sharing that. I feel better it coming from you than me. And that's exactly what I was referring to. And our understanding is that it will be a requirement. We'll wait for that language today. Something could have changed in the last day. Again, what we're looking at is potentially mandatory masking for all kids, kindergarten through 12, and staff and the adults at schools. Dr. Zink, does that help with your concerns?
Yes, because when I talked to them previously, they were using language like recommended, and I said that wasn't strong enough, that we needed required.
And in the chat, we have, I'm sorry, is it Dr. Bob Dannenhofer, who is meeting with the governor at 8 o'clock today and wants to know about what advice he should give to her. Does anybody have input on that? All right, Kathy Swan. Oops. I think you got muted again.
And Lisa Reynolds is here as well. And I know that Lisa Reynolds, masking has been a very important issue for her from the beginning of this pandemic. Lisa, you can probably read what Lisa says about how important that is. Lisa, if you have audio, is there anything you would like to share with this group?
Oh, hi, this is Lisa. Yeah, just thank you. I am so happy to hear that we're going to require masks of students K through 12. It's what I've been asking for. I mean, I think also when Bob asked what to say to the governor, I mean, we're doing so terribly as a state. I can't imagine schools opening in September with rising, numbers just continue to rise. If you look at the graph, which I look at every day in the New York Times, that graph is still going up for Oregon. And we need to get those numbers down. I don't know what they need to be. I know that was a question for someone before we can open, but certainly where we are now makes me very concerned about schools opening. But I don't know at what threshold it would feel safe to open schools, but certainly not with rising numbers. So there's a saying in some of my women's physician groups, close the bars now so we can open schools in September.
Go ahead, Kathy.
So I'm a head of school of a private Montessori school in the West Hills of Portland. We serve 180 children, and I've had an open forum last night with 76 people came, and Thursday night we're doing a second one. And my parents are just demanding that we open online. And some of them are physicians, they're from all walks of life, they're scientists, they're intel, and they just can't for the life of themselves figure out why we would even be considering opening in person. And so I'm kind of following the directives still from the ODE and the OHA, but I sure would like some better direction. And I know my teachers are hoping that Governor Brown will shut it down. So I don't know if anybody has any ideas at what point will she call it? How high does the rise have to go? But it's very hard to be in this position of unknowing.
Hi, I hope you all can hear me okay.
Heather, yes.
Okay. Don't know if my internet's gonna cooperate while my husband and I share it, but I'm Heather Godsey. I'm the president of the Oregon School Nurses Association. Right now I function as the communicable disease liaison at Multnomah Education Service District. So I'm the communicable disease liaison between those 190 something schools and the Multnomah County Health Department. I'm also on the Governor's Reopening Council, and I echo what the council members said here. Many of us pushed for mandatory masking. We also, I kind of asked the governor it might be helpful. I know there would be a lot of pushback across the state, but if we could normalize that before people return to school by making that a state mandate, that children, you know, of school age need to be wearing face coverings out in public as well, just so they get the practice and it doesn't become, you know, a major difference when they go to school. I believe we discussed at the council as well, if OHA could work on some opening metrics. And I believe we were supposed to get the reopening, new iteration of the reopening guidelines from ODE yesterday. As you mentioned, we're still waiting for those. I have heard that that's because they were waiting and looking a little more carefully at some metrics that California and Washington were considering for tying school reopening in person to some public health metrics per county. And what would that look like? Are we looking at, you know, percentage of those who are tested? What percentage test positive? Are we looking at increase, you know, rates? So I think they're trying to look more extensively at that, since we are a local control state, and trying to figure out, can we tie either the mask mandate or reopening of schools to some of these public health metrics?
So this is Bob Dannenhofer. So I'm actually going to be meeting with the governor at 8 o'clock today to talk exactly about this. We've been working on what those metrics would look like using the rest of the world as a guide. So there are many other countries that have opened schools and have done so successfully: New Zealand, Australia, Denmark, France, Israel. But they have found a few things. One is you have to have the disease down to a very low level, about where we were on the 20th of May. So remember, on the 20th of May, we were having 20, 30 cases a day. If we had 20 or 30 cases a day in the state, we would be at a level that those other countries were at when they started, at 300-400 cases a day. There's just no way to do it. There are going to be so many outbreaks at schools that we're just never going to be able to track them all down. I think masks are done. I think the other question, though, is about elementary versus high school. I think there's excellent data to suggest that kids in the K-5 rarely spread, but that kids, once you start to get high schools, spread very efficiently, maybe as efficiently as young adults. And so there's a real concern that, that high schools may be much more dangerous. In addition, it's so much harder to cohort high schools. So those are the kind of things we're looking at. I think we will probably be looking at a rate. I think we'll probably be looking at a % positivity rate. I think we may be looking at the availability of testing, because, you know, if you open schools and have these big outbreaks, everybody's going to want to get tested. And if your test take 2 weeks to come back, that's not going to help. And so we're looking at all those things. The other thing that I would direct people to is there's an excellent article in yesterday's New York Times talking about ways to deal with equity when we go online. And it suggested that schools could be a safe, warm, or cool, depending on the temperature, place with internet where kids who don't have those services at home could go, not necessarily in class, but to go and have basically a study hall where they could get those services. And it really was actually very well written and quite innovative as a way for us to deal with the equity issues when we do this. So it's not surprising that the kids in Montessori schools don't want to go back to school, because without making generalizations, they tend to be higher income. They tend to be people very much into education. So they're likely have those things at home. What worries me is the kids I've seen over the time. I ask them, what have you done since school has started? And they say, play video games. And those are the kids who are going to fall further and further behind. And I'm afraid that the inequities that we already have are going to be multiplied by this pandemic.
Dr. Dannenhofer, thank you so much for articulating that. And I'm sure that you've seen some of these studies coming out of South Korea about the spread, what they're seeing about spread of the younger children and the adolescents. We've got a lively chat coming with some responses and some other comments. Jimmy Unger, if you can hear me, Dr. Unger is the co-chair of our Advocacy, OPS Advocacy Committee. And Jimmy, did you want to say something to Bob's question?
Yeah, well, the AAP has asked for a $200 billion federal investment in restructuring of schools to make them safe. It's hard to imagine that's going to happen in the next 4 weeks. I do agree with everyone's comments about the disease level needing to be lower, but I don't have the epidemiological expertise to say what that looks like. But I do think schools need to be reinvented, and that takes a while. I heard a little bit about the Denmark example where all the high schools are online and they're using that newly available space for the elementary school and middle school aged kids. A model like that, I think, warrants looking into.
Yeah, I think some of the conversations I've had with families was trying to imagine how you would cohort your high school when you're changing classes, you know, as opposed to a single homeroom where, you know, you could do that. So I think that splitting it up with having different approaches for high school and the younger age makes a lot of sense. But yeah, I want to echo that I think your point about investment is a big one. And I think any policy discussion has to be considered, because this idea where each teacher had to kind of create this on their own with varying successes was very, very hard on the school system. I wonder if people, you know, to go back to the masking, you know, I think we all agree that there's excellent data on how effective that is. What conversations for those that are in more direct family practice, working with kids, either resistance or how to, you know, gain acceptance? I like that idea of practicing. We've already had some practice with going to the grocery stores and things, but how are those conversations going? You know, I think a lot of us have had a requirement to come into our office with masks, so we're seeing that. So, Karina, you look like you raised your hand.
If I could share, hi, I'm Karina Brower. I'm the state school nurse consultant, so I'm housed at OHA, and I've been in conversation primarily with school nurses themselves. One of them shared recently, she's doing some summer school work. One of the districts that she's been in has signs up saying masks are required on campus, even during the summer. And she, in her anecdotal observation, it was pretty effective. People were wearing masks. In the place where she's actually doing her summer school, they're not required. In fact, they had sent out letters saying, mentioning the fact that these are optional. And in the previous guidance, they were. It was recommended, but education cannot be denied for those not wearing a mask. So it was made very clear in their letters that this is an optional thing. She said, I had a pile of 30 masks available. I had 4 kids and 2 of them were willing to wear them. The others just didn't seem interested. So for her, the idea that we need that messaging, I'm so glad to hear that that's coming out. Just the messaging itself, even before it was mandated, made a huge difference in that tiny anecdotal study. And we've had discussions, certainly within the school nurse groups, of those kids that are in terms of developmental ability to wear a mask appropriately and that sort of thing. And I think Heather is speaking to this really articulately, but even when it's not done perfectly, we know that there's a lot of data that this is going to be helpful, and that's been it's been a source of concern for anyone who's going to be in the school system, to be around so many people that aren't masked. You know, the nurses themselves, I've got family members who are high school teachers, and just the fears of going back without having that strong language saying that this is a required thing. So that's where I'm coming down. I also wanted to share, we're talking about equity issues with online school. And I'd like to also recognize that there are some pretty significant equity issues with in-person school, that we've got some really disparate differences between communities, and especially along racial lines, that our history of underfunding schools in certain areas with certain populations still exists. And it means that those schools that might be opening in person in certain areas and with certain demographics are going to be facing a lot more challenges doing that safely, and just recognizing how disproportionately that's going to affect those populations. But masks, we're all for them. I'm so glad that that language is in there.
Dr. Karina, thank you so much, and I'm so glad you brought up that equity, the equity issue. I know that Dr. Dannenhofer is going to have to leave in a couple minutes, but Dr. Dannenhofer, I think you've heard loudly and clearly from this group that we want to thank the governor for a strong stand on masks for kids in schools. Some of your other questions will be possibly talked about in the next hour, and we're going to be pulling a summary of this meeting that we can share with folks if that helps you later as well. And again, thank you for your service, and Dr. Lanciani, and we might have a couple of other, and I'm sorry I can't see everyone's name, but we have 2 other pediatricians who are on the Governor's Council on early learners as well. So the pediatric voice is being represented well. More folk, I see that Nicole has her hand up.
So what can we as pediatricians do to advocate for increased funding to help schools prepare for either in-person or online school?
That's a great question. I know that we're doing some work with the AAP on a federal level with writing some letters to our Oregon congressional delegation, which, as you can imagine, is pretty supportive of that. On a local level, or community level, or state level, I'd love to open that up to other folks that have ideas. And feel free to join in if I can't see you. We'll park that question for now, Nicole, and we'll kind of keep percolating on it. Let's keep talking about the equity issue and the disparities that we're seeing. I think that's really important. But one thing that I will mention as we might pivot a little bit off the masking issue is that OPS has been asked to develop an informational campaign geared towards probably mostly families, but anyone about kids and masking or face coverings. And we know that that might be a desensitization process. We need to, of course, articulate why it's important, and we need to talk about, maybe the special concerns that families and kids have with that. So we'll be pulling together some volunteers to help us with that information and guidance. So if you're interested, please email or send a message in the chat to help us develop that. Equity concerns. Dr. Carolina Amador is on the call. Good morning, Dr. Amador. And I know that she works in Benton County with an FUHC in the school-based health center. I'm sorry to put you on the spot, Carolina, but is there anything that you want to share, or can you share with us verbally?
Well, I mean, just my general experience is that children of all ages just did not do well in the spring, and are continuing to decline in their mental health and even in their physical health. I've seen kids gain 10, 20 pounds, over these last 5-6 months. And yeah, I mean, physiologically, I think it makes sense to have K-5 be in person. Although I have concerns about the older kids, they are not doing well. And so some kind of accommodations to meet in person from time to time, or checking in or something to, accommodate that issue with them.
Thank you. Thank you, Dr. Amador. Other thoughts on that?
I wanted to comment a little bit, Dr. Lanciani again, on the older children in the high school. And one of the remarkable things about this K-12 committee that the governor's put together is that we have high school students on that committee who've shared their experiences with us. And I have to say, all three moved me to tears last week, telling their experiences of how difficult it had been for them as teenagers. To not be with their peer support, and that really has a really deep impact on adolescents. So we have to acknowledge the reality of ES. It does appear that adolescents probably do, spread COVID, and we have to think about options that we can give them to safely educate them in person if they want, or at home if they prefer, and also to keep our teachers and our administrators safe. I do think it can be done, but it has to be done thoughtfully, carefully, and it has to be done with vigilance. And I think that's one of the biggest problems with this pandemic, is that the virus never stops. The virus never gets bored of being a virus, but we kind of get bored of protecting ourselves and protecting each other from the virus. And I think that schools are the absolute perfect place to teach public health interventions to our children. We've been doing this for generations. We do it for fires, we do it for stranger danger, we do it for safe sexual practices, we do it for so many things. There's absolutely no reason we can't use our school systems to educate our children on how to protect themselves against this real threat. This is not a warning, this is not a drill. COVID's here, and we should use our schools to teach our children how to protect themselves and protect their families. I know that teachers and administrators are not physicians. They are not trained in how to use PPE. This is a whole new thing for everybody outside of the healthcare community. And we need to take some time now to think about how we're going to train our teachers and our administrators so they can then go forward and train their students. And I think that I don't want to lose that bit, because I know that it's difficult. I mean, it's difficult for me as a pediatric infectious disease doctor sometimes. So, what do I put on first and what do I take off? And, what is the best way to protect myself and protect my patients? So we have to spend that time. But I do worry. I don't want to quite throw up our hands on having in-person school for the older children, because I do think that it is so critical to their development. I do think it's an essential service for these children. And I think that there are ways that we can do it in a safe way. There's never going to be a way that we can eliminate the risk of COVID in schools 100%. It's impossible. All we can do is safely, or try our best to safely mitigate those risks, reduce those risks. But unfortunately, there's just nothing that we can do to eliminate them. I think my other concern that I saw in the chat box about testing, and I think that that's so important. What are we going to do when kids are sick? Okay, if you look at the list of COVID symptoms, it's literally almost every symptom you could ever think of, right? Cough, sore throat, a headache, diarrhea, upset stomach, it's everything. So what are we gonna do when you have 15 kids in a classroom and 2 are out sick? And right now, as you all know, you can get a COVID test with some patients or whatever. You can get a COVID test. It's taken a week or so to back. That's useless. We can't go into the school year like that, okay? We need a testing plan, we need availability, we need every child, no matter if they're in Portland or if they're in very rural Oregon, to be able to access COVID testing and get a quick result back to do this safely. And to me, that is my biggest concern right now. In addition to the increasing case reports, of course, the second biggest issue is that the testing system, I feel like we're back where we were in early April, really, with testing. We need to improve that. It's a national crisis. And there are much hotter spots in the United States than Oregon, thank goodness, in terms of COVID. But that also means that when we're crying for resources, our calls will not be heard because they're louder calls in other places. I don't have a solution to that at all, unfortunately. But I do know, as both a parent and a physician, we need a very explicit plan. Who needs to get tested? When do they need to get tested? When do we have to close down a classroom because of COVID? When do we have to close down a school because of COVID? That all needs to be thought out, and testing needs to be a reality, not just something that's written on paper that no one can actually access. I'll stop now.
Dr. Lanciani, thank you. I think we have a lot of people clapping, and the chat is thumbs up. So again, thank you. And for those of you who don't happen to know Dr. Lanciani, she is an infectious disease specialist at pediatric infectious disease specialist at OHSU. So she wears a lot of hats, including that of mom and advocate and other things. There's so many different issues that are popping up around all the things that we're talking about: testing, mental health. I know that Dr. Stuart Newman's on the call, and Dr. Newman's a child psychiatrist. And Dr. Newman, welcome. I certainly, you, as many of us, are concerned about the mental health crisis that is also happening, as well as the lack of eyeballs on kids to check in with them and know how they're doing that school provides. Dr. Newman, is there anything that you wanted to kind of share from your perspective?
Thank you for the opportunity to speak with all of you and participate in this. I'm seeing in my practice, I'm part of Mind Matters in Hillsborough and West Lynn, and we had seen a significant amount of fatigue in the families as the lockdown proceeded into the summer. People got very frustrated and really struggled to be able to cope. That has now really morphed into difficulty with what's going to happen as the school year approaches and the uncertainty about whether or not school is going to reopen and how families are going to cope with that. So I appreciate and absolutely echo the concerns about the spread of the virus. I think what's happening in parallel with that is we are seeing an increase in service requests and intensity of challenges for families and patients because the isolation, because of the lack of resources. And so there's sort of a co-occurring mental health crisis that is taking place. And I want to just make sure that part of this discussion is appreciating that the mental health needs are going to go right along with the physical health needs. And that's a huge concern. I know OPS is doing a program in a week on that specifically, but my hope is that that can be part of the discussion as well. So thanks for the opportunity. I appreciate it.
Thank you, Dr. Newman. Other folks want to chime in. Dr. Johnson, I think you're...
Yes, yeah, Kyle Johnson. I'm a child psychiatrist at Dornbecker, and thanks, Stuart, for your comments, and Christina, too. I'm very concerned about the teenagers, the middle schoolers and teenagers, so I appreciate very much Christina's thoughts on that. At Dornbecker, we're seeing, I direct a consult service, and where we see kids that end up in our emergency room or on our pediatric floors or in our ICU and psychiatric crisis, often after a suicide attempt. And that typically we see a decrease in numbers in the summer months in July, and we're not seeing as much of that dip. And I'm hearing similar things from colleagues around the country too. So I do hope the older kids can return to school for the reasons that Christina stated, and that we just need to understand that it's not without risk, but much of life is with risk. And I think the benefits of having the older kids return is greater than the risk if we can provide enough safety and vigilance, as Christina mentioned, which I have to say I'm not convinced that we can put that together in the next 4 weeks or 6 weeks or 8 weeks. But we need to see what the governor says, I guess, today.
Yes, thank you. Thank you, Dr. Johnson. Trisha Schroffner. Hi, Trisha. Glad to have you on this call. Has some comments about school-based health centers. Trisha?
Yeah, hi there. Thank you. I'm a nurse practitioner down in Eugene at a school-based health center, and about 75% of my patient population is adolescents. And so I just want to echo some of what's being said. I really hope that there's a world for them back on site. I think with all our national discussions around racial inequities, food insecurity, I'm looking at grants for our LGBTQ community that's being hit hard. And I think that it's so important for them to be back and to have that access. I think that we can absolutely work on changing culture for them and wearing masks. I was on a webinar last week talking about mask breaks, so following the science, and you wear your mask here, but now we're going to go outside and you can take your mask off. That type of thing can help make that a little bit more bearable for children. And they were also mentioning clear face shields as being potentially beneficial for teachers, that children who are learning from teachers where they can see their mouths and their facial expressions are really important. And I've been debating on that just in my own practice, wearing that, because I find myself, even though I'm more of a primary care provider role in the school-based health center, I'm doing a lot more mental health visits now during this COVID time, a little bit outside of my comfort zone. I usually work with 2 therapists in my suite, but they are working from home. And so for my students who don't have good Wi-Fi or don't have a private space for a phone call visit, they're coming into my school-based health center because we're located in the community and they can walk. So I'm doing a lot more of those types of visits, and I'm thinking maybe more of clear face shields might be good in trying to connect with them too. Such a challenge.
Oh, Trisha, thank you. Agreed. Jackie Miller, if you're hearing me on the call, you've had some great comments in the chat. Sounds like you're doing a program in the summer. Jackie, can you kind of introduce yourself and tell us more about your thoughts?
Hi, I'm Jackie Miller. I'm school-based mental health therapist at the Mitchell School in Wheeler County. We're extremely small school, so things are a little different here. But what would you like me to speak to?
Oh gosh, Jackie, and I'm so sorry, I didn't mean to put you on the spot, but yes, so we're so interested in kind of the work you're doing, and how are things going in Wheeler County?
We haven't had any COVID cases yet, knock on wood. Normally I do a summer program and it's based in the school, but we're not allowed in the school building this summer, so we chose to do it outside. And I've had to be very creative with things for social distancing, take their temperature every time, and then we do games like pool noodle tag where they're, you know, that's quite a distance apart when they can tag each other with the pool noodle. I've really had to think outside the box, but the kids are just eating it up. They miss each other so much. I've also done online groups for preteen and teen girls, and they just love it because they miss that social interaction. They need it so much. And we've had really great discussions around COVID, around anxiety management. With the littler kids, we made like unicorn pillows online together. You know, we're trying to be as creative as we can and still cover their needs, their mental health needs. But the kids have a lot to say. They're, you know, they want to go back to school so much that the social interaction is like primary to them, even all the way down to kindergarten, you know.
Absolutely. Jackie, thank you for being so creative and doing that great work with our students, and especially around keeping their mental health as strong as possible. No, this is a concern to so many of us. Jamie Peterson's on the phone, on the call, excuse me, Dr. Peterson, and I just wanted to kind of, Dr. Peterson has a unique perspective because her background she's a former school teacher in Oakland and is now doing primary care at OHSU. Dr. Peterson, any thoughts that you have about any of these issues or something different?
I think all your perspectives are so on point. And, you know, the biggest part that I would add is from the teacher perspective is, I think for the beginning, I think we lost a lot of time focusing on the kids and kind of forgot about how to protect the teachers. And that may just be what it, you know, from my perspective. My husband's also a teacher. And I think we really worried that the kids were going to be these super spreaders, right? And I think we're finding now that if we could mask them and give them safe space, they can probably do okay, assuming what you guys have already said, that we have low case rates. But I'm feeling there's a lot of concern from the teachers that they weren't at, and this is sort of across the country, just weren't at the table for some of these discussions. And how are we going to keep them safe? And what are we going to do? This has come up in here. Who's going to take over if a teacher's out for 2 weeks? Is it good for it to be a substitute who doesn't have the relationships with the kids? When so much of what we're seeing is the social emotional support and the benefit of being in school. You know, I think my other perspective is working in a very underfunded, under-resourced area in Oakland, and the disparities, as somebody astutely points out, we've been underfunding schools for forever, right? But I think maybe this is our opportunity to change that. And I think we can finally realize how much schools do provide, even if there is giant inequities. And the biggest thing they provide us right now is a safe space, supervision, food, temperature control, and then the social support of peers. Quite honestly, if there was little academic learning happening next year, those benefits will be huge for kids. But I think we have to figure out how to do it safely for teachers. And I don't have that answer. The only other thing I'm curious for those of you on the governor's council is if you're getting a little bit of examples of case studies from private schools. For instance, this is where the examples of what funding, if we could get funding, what you could do. If someone wants to answer that, they can. I would say for an example, that my husband teaches at a private school and they have cameras now on their whiteboard. So it will watch him as he's teaching. So if a kid is out for 2 weeks because they have COVID, they can sit at home and watch him in real time. So even if the class size gets cut in half, they can be keeping up. That's just, obviously those are not cheap, but they're not horribly expensive either. So it just goes to, there really does need to be a call for funding on how to do this safely. I don't have much else, any other things to add. That's my perspective.
Excellent.
Dr. Pearson, thank you.
Jay, Dr. Rosenblum, you had your hand up earlier. I just wanted to see if you wanted a chance to jump in.
Yeah, thank you. So I had a question about paper tests. The tests that are less than $1 each can be done at home, can be done every day, and even though they don't catch people who are in the convalescent phase, has anybody heard about any programs to be able to access and widely distribute those? Because they do tend to catch people who have a viral load that are contagious. So maybe not in the first hours of the illness and not when they're convalescing, but the only tests we're hearing about are the RT-PCRs that are taking a week to get back and cost $100 each. Has anybody heard of a program that we might be able to do widespread free? I mean, it's the kind of test you could even do it daily. Anybody know anything about that?
And if anyone does, feel free to jump in on the call.
Jay, are you asking? I guess the antigen testing, I think, is more, is more office-based, and I think I did early on heard concerns about sensitivity, but you're right. If it's the threshold of contagiousness, then there may be a role for that. So yeah.
Jay, maybe we'll have more thoughts on that later. I know that we've got a lot of folks that are working with childcare, daycare, some pre-K. We've got some questions about the benefits and risks of being in person with ages 0 to 5. A request for some opinions about that. Would anyone like to jump in about the childcare issue, which, as we know, has been talk about being under siege? This very essential service that and again, our partners with the Early Childhood Council here in Oregon have been very strongly advocating for more funding for childcare providers. I know that's been going on the federal level as well. Who wants to talk more about the 0 to 5 population?
I certainly can provide some insights. Or maybe. So, I mean, what we know about the risk to the child, right, in that age group is that it's incredibly low. Infants, so children less than 1, we do see COVID disease in that population, and there have been, unfortunately, some deaths reported in young infants, particularly those with other underlying morbidities. But particularly the children, from ages 1 up to really 5, 6, 7, it seems to be kind of this really sweet spot when it comes to COVID-19 disease. They don't seem to get particularly sick. And from the data, the evidence that we have so far, they do not seem to be very good at spreading the infection either. So in terms of both risk to the child, risk to the teacher, risk to the family, those young children, like this one right here.
Yes.
You
know where
okay.
my camera is?
No. Oh, it's right there. Sorry. So they seem to be the sweet spot. And so it's, you know, of all the risks, they're the lowest. So that being said, however, I think that the problem that we have is that they also seem to be the lowest priority in terms of people recognizing how important it is for them to have access to in-person education. So we still, many of us in the United States, although many of us here in this forum recognize how important it is for pre-K and preschool to happen, still in the United States, that's not, it's still sort of, yeah, if you can afford it, if you can do it, you send your kid to preschool. If you can't, you don't. And many of my very educated peers, not at work, but in the community, I've been shocked actually to hear from my son, who hopefully will be starting in-person pre-K in 2020, that many of the kids who I thought were gonna be his classmates, the parents are making the decision to keep them home. And it's more of a kind of, I just don't want to deal, I'm overwhelmed, it's not that important, they're only 4. And so they're just deciding to keep them home. And it's heartbreaking. Because to me, I mean, my goodness, I've considered radical things like quitting my job and like starting a home preschool or something, like, because it's so important for these kids to socialize. So, and the same applies to childcare, okay? Again, these are low risk children. It's low risk for them. It's low risk for the people taking care of them. It's low risk for them transmitting to the people at home. It's not no risk. There's never no risk in medicine, I'm sorry. I can't say it's impossible for a toddler to get very sick from COVID. I can't say it's impossible for a toddler to give COVID to their daycare provider. It will be, it's possible. You know, is it probable? No. Is it likely? No. Is it common? No. But it's not impossible. So I think a lot of families think it's expendable. It's not that important, and that's an issue. So they're deciding perhaps now when all of our finances, personal finances are strained, that if they have to pay for that child care or that pre-K or their preschool, they're not prioritizing that right now. It's stressful. It's not a priority. It costs money in many cases, and they're deciding that's where they're going to cut. So I think a lot of it is education about how important this is, and really in the scale of risk for COVID, how actually quite safe it is. Providers could certainly wear masks. Providers could certainly wear a mask with a face shield, which let me tell you is extremely uncomfortable to do, okay? But you could do it. That would be very, very good protection for the provider themselves if they were high risk or had some health concerns. So there's certain things that could be done to protect the provider in the healthcare in the childcare setting. You know, wearing masks at that age, I think I will tell you, Jake, my 4-year-old, he's the best mask wearer in my family over me. Okay, he wants his mask on all the time. So I think, you know, and that's, you know, children are different and so forth. But I think young children, you know, when you teach them something, and this is very important, they often become the little, you know, the really, you know, the enforcer of the household, you know, wash your hands, mommy, put your mask on, and those types of things. So I think in some settings, you know, if people want to see if there's a lot of anxiety about wearing masks, you know, it could be done. It's not going to hurt them. So I think it's an issue of priorities and finances, and not really understanding the importance of in-person education for that age group. So
Lanciani, thank you for that. Appreciate that. And I know we have some other folks who can probably weigh in on that. I know we're running low on time, but Kathy Mooney, I think that you might have had something to say at one point, and I don't know if we missed that window. So I want to give you a chance. And also I know that Elena Rivera with the Children's Institute is on this call. And Elena, I'm not putting you on the spot either, but I wondered if you had any piggyback or follow up to Dr. Lancioni's comments. Kathy, did you want to say anything? No, you're good? Okay. Elena, if you're there and if you can talk, did you want to say anything?
I just so appreciate the discussion that's taking place right now, weighing the pros and cons and particularly elevating the equity issues. I think that all of the concerns that are being raised about school-age children, K through 12 school-age children, are just as crucial to address about our 0 to 5 population, and also acknowledge that for how few resources our schools have to implement safety and health guidance, our child care centers have the tiniest fraction of those resources. And so as we talk about advocacy for funding and support for schools, I hope that we're also able to elevate advocacy for funding and support of child care centers and preschool centers in our state, who, you know, they're often in a position of having even less choice than school districts right now, especially in terms of providing care to essential workers. Many childcare centers have been open throughout this entire pandemic with very limited support. And so just want to bring that into the conversation, but I really appreciate Dr. Lanciani's messaging about how crucial it is for this stage of development in particular, and the cognitive development that's taking place, the social and emotional development that's taking place, that is often the foundation of children's readiness for kindergarten and all of the learning that will take place in the K-12 system. So I just really appreciate those connections being made and the kind of clear messaging I'm hearing about the very low risk for children 0 to 6 or 0 to 7. And so I would love to just continue to elevate this issue, and may even be following up with some of you to see if there are opportunities we can have to collaborate on some shared messaging. So thank you very much.
Elena, thank you for, again, you and the Children's Institute for being one of the leaders in this area. You know, there have been so many great comments. Jessica Thompson, Stacy Russo, the comments that you've been making. Just know that all of the chat is going to be collated at the end of the meeting and again shared. So if we haven't had a chance to call on some of you, just know that your comments are appreciated and recognized. We are getting close to 8:30, and I want to honor everyone's time. This is a conversation, frankly, that could go on for a long time. And I know that there were some questions that were asked that probably were not adequately addressed, and we can do some special follow-up afterwards. You know, Dr. Rosenblum, I don't know if we really, you know, if you got enough, for example, with your question, but Greg Blaschke is on the phone call, and he's been texting me some ideas, so we'll follow up with that. I do want to say that we want to continue this conversation, and one of our ideas is we launched a little while ago our very first Ask a Pediatrician that was geared for families, talking to pediatricians and having their questions. I suspect this would be a hot topic with them, and would love to follow up with some of you, whether you think that we're ready for that. Are you ready for that kind of prime time? And maybe get you to help us with kind of a follow up to this that would be more inclusive of families. Please email me or go to our website. You can find a way to get a hold of any of the staff at OPS with your ideas. Like I said, we've been asked by OHA to create a kids masking campaign. They wanted it to not come from the government to try to increase the response, you know, the positive response, but it will certainly be shared by any agencies or groups that need to do that. You'll hear more from us about that. Anyone have any burning last comments before we sign off? Okay. Thank you all. This was well produced time. Thank you, Ken. Thank you, staff, and thank you all for showing up so early in the morning. And again, for our people who are policymakers, thank you for all of the stuff that you're doing statewide.
Yes, thanks all. It was a great group, and we'll keep the conversation going.